are new warnings this morning about a possible link between severe lung disease in teenagers and e-cigarettes and vaping. Minnesota is now the third state where serious lung injuries were reported in just the past month. CTM consumer investigative correspondent Anna Werner has been looking into these e-cigarette concerns. And I know there are a lot of questions about these cases, but what are we learning?
So these 4 Minnesota cases, Tony, involved 16 to 18-year-old teenagers who wound up at Children's Minnesota, the children's hospital there. I spoke with the chief medical officer, Dr. Emily Chapman, who told me about a pattern of cases with a similar but unusual path. Now, these teens at first had symptoms that suggested a viral or bacterial infection, but doctors determined their lungs had actually sustained some kind of acute injury, and then the lungs began to fail. Some of the teenagers even had to be put on ventilators to save their lives. Now, Dr. Chapman says her doctors cannot yet identify a common factor like a particular brand of e-cigarette, a drug, or an oil. But the State Department of Health says use of both nicotine and marijuana-based products were reported. At least 22 similar cases have been reported in Wisconsin, Illinois, and Minnesota in the past month. Health officials are still investigating these cases and any possible connections. The American Vaping Association tells us that with approximately 10 million adults vaping nicotine each month without major issue, they say it appears much more likely that the products causing lung damage contain THC or illegal drugs, not nicotine. But so far, nobody can really say for sure. Dr. Chapman wants patients and families to know if symptoms get worse or you or a loved one is being treated for presumed pneumonia, that it's important to follow up with your doctor and make sure you tell them if you use e-cigarettes, which has been an issue with teenagers who may not want to admit.
No, very hard.
And we've also heard of teenagers who have been asked, do you use e-cigarettes? And they say no. And then they're asked, well, do you Juul, which of course is the gorilla in the market, the Juul product, and then they say, oh, well, yeah, I use Juul. So that there can be a disconnect. Now, again, we're not saying that Juul is to blame for all of these, but there is a distinction in some teens' minds between e-cigarettes and Juul. They don't even think they're the same thing. So you really have to ask these kids.
Yeah, and health officials are looking for that common factor. We hope they find it.
Yeah.
Yeah. Okay, Anna, thank you.